Hi friends, let me just tell you what is pre-implantation genetics testing for aneuploidies or PTG-A in IVF. Humans, unlike the animal kingdom, produce embryos, but plenty of these embryos are abnormal. And these abnormal embryos are called aneuploid embryos. They are structurally, chromosomally defective embryos. And when it comes to rat or for a cow or for in our dog and a cat, the number of aneuploid embryos, the number of fetal defects, the baby defects in their kingdom is very, very less. Unlike the humans, especially having an abnormal embryo or a genetically abnormal embryo is very high moment your age crosses 35 years. Having a genetically abnormal embryo is not related to any other factor. It's not related to you being obese or thin. It's not related to whether you have PCOS or you don't have PCOS. It's not related to you having a low ovarian reserve. Not related to AMH levels, FSH, etc. It is only related to age. So as your age advances, though you could be producing good number of embryos, but just because you're trying for a pregnancy beyond 35, you are destined to produce more abnormal embryos and your chance of pregnancy goes down. So we highly recommend in IVF for the women or the couples who are trying beyond 35 years of age that do go with PTG-A. What is the advantage and what is the disadvantage? The biggest advantage is you are transferring a euploid, that is genetically normal embryo, into the uterus. All of us who are living on this planet Earth, we are all euploid. Because we are euploid, we have such livelihood. Then why not put a euploid embryo to the uterus and the chance of implantation will be very, very high. It has been proven in all the studies that when a euploid embryo is put, the pregnancy rates are very high compared to an embryo which is not tested by PTG-A. For a woman who is at a lesser age, for let's say between 25 to 30, 32 years of age, in those women, because they are young, the risk of having an aneuploid embryo or a bad embryo is very, very low. In those women, there is no need to test for PTG-A unless they have suffered from repeated abortions in the past or they have had 2 or 3 more IVF failures. But for the older women, it is better to go for PTG-A. So now that I've told you that transferring an euploid embryo will increase your pregnancy chances, what is the disadvantage? The disadvantage is the journey to reach that euploidy. As a doctor, can I do something to you to improvise your euploidy? No, there is no particular method. But in low ovarian responder patients, sometimes we give growth hormone injections, which could be improving the embryonic quality, but not yet proven whether it improves euploidy status. Well, will taking certain medicines will help? A certain medicine will not change euploidy, but certain medicines will increase the number of eggs, number of embryos, and just because your embryos are more, chance that there is a euploid embryo. So journey to reach an euploid embryo could be little tough. Tough in the sense you may not reach an euploid embryo in the very first cycle, you may require 2 cycles. So, but your chances of acquiring a pregnancy is very, very high. Suppose you don't do a PTG-A and you go through, and you're 38 years of age and you're going through a cycle, you transfer a blastocyst, you're not pregnant. Probably you're looking for a cause of not achieving a pregnancy in yourself, but actually the cause was in the embryo, which was not euploid. If you have tested for that, that clears of the matter and chance of pregnancy is better. There's a beautiful study published by PTG-A et al., wherein he retrospectively analyzed all the women who were transferred 3 euploid embryos in successive cycles. Like 1 euploid blastocyst was transferred in each cycle. And they noticed a cumulative pregnancy rate of 92%. That itself suggests that transferring an euploid embryo for somebody who is older couple trying for pregnancy is of immense benefit. Thank you.